Extreme success is the result of working hard, dreaming big, learning from failure, loyalty, persistence, and resilience. Hello and welcome to another episode of Extreme One to Watch. It is with great pleasure that I get to sit down today with Dr. Leslie Schur. Been such a wonderful patron of extreme barrel racing and so many other things. And we're just gonna dive right in. I'm just so excited. Thank you so much for coming and joining us here today.
You betcha.
Tell us how you kind of got bit by the horse bug.
So I grew up in the Northwest in the state of Washington, and we had horses from a very young age. Would do a little bit of the game shows and barrel races in the Northwest. Never really got bit by the high school rodeo bug, but was pretty consistent going through. Always knew I wanted to be a veterinarian, always knew I wanted to work on horses. And then, as I struggled through vet school, I did take my horse with me, did a little bit of college rodeo, which was a lot of fun, and then struggled for a lot of years getting through my education, but had that horse there for some stability all along the way, and did have the opportunity to run every once in a while, which was great. And then I got done with vet school and I did an internship in Arizona, again with my trusty steed alongside of me, and every once in a while we get to hit a barrel race, and then moved to Las Vegas in 1996. Been here ever since, and I've just been really blessed. Early in my career, I met some good friends that were clients, got to run barrels a little bit. For the next 10 years, when the practice got busy and I became a mom, then it all changed for a bit. And then when the girls were very young, just kind of started getting our feet wet again, getting back into it. And we actually still had all those old horses that I had run on earlier. And it's funny because you never really know that you have a kid's horse until you put a kid on them, which is often very frightening. But we actually had some really good ones to help raise the girls and get the bug lit in them.
Oh man, and you have, those three daughters are just gems. They're so fun and they're well-mannered, and they're just hands. I mean, you and your husband have taken and really raised three beautiful daughters. Would you want them to be a veterinarian?
Yeah, I actually, yes and no. It's a fantastic profession. It's very trying, but it's definitely a career of passion. And if that's where your heart lies and you can arrange things to work with your schedule, I don't think there's a better job to have. So out of the three, I've had one say she wants to be a veterinarian, walk back away, and now she's circling back. So it looks like Markel is headed down that path.
Oh,
so
fabulous.
She's decided she wants to be a radiologist. She's already thinking ahead on figuring out her schedule, because radiologist truly doesn't have to actually always be with the horse. She can view those images and do consults over the phone and the computer. So she's already planning out life so she can still enjoy her barrel horses.
And you make a good point, because a career has to be able to play well with this passion of riding and competing. But there are so many different lanes of veterinarian medicine, as you have mentioned. So where's your expertise, and where have you been able to grow and expand your practice?
Yeah, so when I moved to Las Vegas, I joined Dr. Garth Lamb, who was my kind of mentor growing up in my practice life. And we worked out of a hole in the wall. We worked out of our trucks. We did have a little third place where we did a little bit of surgery, but we didn't have anywhere to hospitalize things. So from that, in 1998, we built a hospital, kind of a small utilitarian practice as we went there. And since that point, we went from the two of us to, at the most, we've had 6. We now have 2 surgeons, a boarded internal medicine specialist. We're expanding our practice at this time, adding some new diagnostic modalities. So it's come a long ways. I enjoy working and building those relationships with my clients and their horses, because what we forget about is really, especially at the elite equine athlete level, you all have to be on the same page. You all have to communicate. So I like it when I work with the client. I know the horse, I know the farrier, I know everything that they're doing, so we can kind of put those pieces of the puzzle together. Because if you've seen in the arena, you know, where hundredths of a second make a difference, we got to make sure that those animals are feeling very well. So long, consistent relationships. I enjoy challenging lameness cases, internal medicine to a bit. We do a fair amount of breeding, embryo transfer, so a little bit of everything
Yeah.
that I enjoy. But I really like working with clients and their horses on a consistent manner so that you get to know them very well.
Really good point, Leslie. And the other thing I would ask you is, what are some of the major illnesses or issues that you see in the modern barrel horse now that's being very challenging to be able to not only diagnose but to treat?
Yeah, so we always jump to lameness. We think when a horse is not performing that there's a lameness problem. And very commonly, I would say probably if we weighed it, that musculoskeletal problems contribute to a lot of the performance limiting problems. But we also have respiratory problems here in the desert, especially with the dust and the allergens. We do see a lot of horses that are challenged with their respiratory systems. And then, things like gastric ulcers, and every once in a while we'll find one that's not performing well, and you'll find an ovarian tumor or something that's way off the beaten path. So while it's often a needle in the haystack, you can play the common things, but you can't always rule out the others. So trying to keep, an annual CBC chem on those horses to make sure that their organ function is good, making sure every 6 months you have your veterinarian go over them, look at them, look at their feet, their tendons, flex their joints, make sure they're all moving okay. Because if we can catch those problems before it ends up being a performance limiting issue, that's what we'd always like to do so they can keep at their best.
Well, and that's such great, helpful hints and tips. How often, you mentioned, how often should you just have a wellness checkup on your horse then?
I think if they're performing at this level, every 6 months at the bare minimum.
Yeah. What do you feel about injections and their overall use and help?
Yeah, so I think a lot of horses need them. We do ask our animals to do a lot. And so what I always tell people is just because we're x-raying a horse and their x-rays are clean, it doesn't mean that we don't have inflammation in a joint, which will later set up those degenerative changes that will change on an x-ray. So we'd like to catch those before them, and that's where our injections come in. So if a horse has a flared up hock, fetlock knee, and we can tone down that inflammation, we might keep it from going to the next level where it's got bone spurs and degeneration and changes in that joint. Do I think there's any such thing as a routine injection? No. I don't think we should ever just roll them right in for their oil change and go on with it. I think we should go over them head to toe through palpations, a thorough exam, some flexions, keep watching them move, and then move on. Yes, we do think that these hocks need a little attention. We can see that the hoof wear pattern is changing, the way that they're moving, things that kind of point to that area where we can keep it feeling good before it's a real problem.
Well, and nutrition plays such an important part in a horse's balance of their keeping a healthy gut. And let's talk about, how can people prevent and help to try to eliminate a colic incident, because that claims so many horses' life. Is there anything that you found that really can help with that?
Sell all the horses.
You'll never lose another one if you sell them all. That's
no,
funny.
I mean, but that's what my clients ask me after a colic surgery. What can I do to ever keep this from happening again? And so many of them do all the right things. I said the only way you're ever going to prevent it 100% is get rid of them all. Yeah. But that, all kidding aside, avoiding major feed changes. So the 3 most common things are anytime within 2 weeks of a major feed change, environment change, or weather change. So you've moved a horse, you've changed their feed, the weather got different. Those are all things that predispose it. Other things like mares that foal, then the foal's gone. We have a much higher incidence of twisted colons, but a very consistent feed source. And those horses that intermittently colic, trying to get to the bottom of why that's happening. We will see inflammatory bowel disease in horses. Some of those horses end up having to go on a little different diet, sometimes some corticosteroids, gastric ulcers, that's something that we see very commonly in horses as well. Easily diagnosed with gastroscopy, where we put a scope down into their stomach and take a look around. So those things are very helpful, and sometimes we'll put them on a prebiotic, probiotic. In the desert, we'll deal more with sand where they're nibbling on the ground. So there's a whole lot that plays into it. You're absolutely right. But consistent programs are probably the most important.
Oh, great advice and great lot of great information here that we're sharing to our uh, viewers. So if we could talk about, is there anything that we may not have covered that you feel like we need to share with our viewers about barrel horses and their care?
Yeah, so I think that there's some things that we forget about too, and that's hauling, traveling, what we put our horses up against, how far we're going to take them, giving them a day to recover before we run them. And it's the elephant in the room with professional rodeo, where it's a little bit of a road race of who can get there and who can do the best, right? After 15 hours of driving and pulling the horse out of the trailer. And we forget about what stress that puts on an animal. Even the most elite human athlete's not going to go get on 5 planes, jump out and be a track star. Like, they need a little bit of recovery time. So that being said, trying to plan your trips where you at least have a little bit of a break in your trip. Give them, when they're on the trailer, the reason horses have more respiratory problems when they're hauled is because they're not able to put their head down in a trailer. So people forget about it, that it's something very simple, but the way that they clear their airway, if they've got mucus, is putting their head down and coughing or allowing that stuff to come out. So if you're in a trailer for 15 hours and your head never gets to go down, then we have more respiratory problems. Keeping up on vaccinations, super important, right? Because we have commingling of horses so closely. And so things like influenza and equine herpes virus, those are things that are very common when we get a lot of horses together. So making sure your horses are up to date on their vaccines before we travel as well. And then just looking at, maybe we need to put a little bit more on their feet. Do we need to put them in some soft rides on the trailer where they've got a little bit of balance and can feel a little bit better in their feet? And just trying to be proactive about what we do, because all the injections and keeping them sound is all very important, but we've got to not forget about putting them on a trailer, hauling them, commingling them with other horses. Those things are all shouldn't be forgotten, to keep them
what
at their
great
best.
points. I mean, all of that is so, because you're right. Once we've had one issue, it's instilled in us that we need to take care of that. But there's all of these other preventative things. You hear a lot about horses that bleed and that they have problems with that. Do you know really what you feel like causes that? And is there any preventative, or how do you treat a bleeder?
Yeah, so it's a change in blood pressure in the dorsal part of the lungs, and those vessels kind of blow out. What we found in horses that are barrel horses especially is there's a lot of inflammatory airway disease that's involved. It'll change that pressure, and then they'll be more likely to bleed. There are certain facilities where I see horses bleed consistently. People walk into my vet room and say they have never bled. I've had them 10 years, they've never bled till today. And it never surprises me, because those might be environments that are a little bit more dusty, some things are a little changes. So whereas I don't know that Lasix is the answer for every horse to run on, in those environments we need to do everything we can to make sure their respiratory health is the best that they can do, whether it be wet down your shavings, maybe wet the hay a little bit. Sometimes we'll go on some nebulizers to open up their airways a bit. And then maybe some of those, environments they do need to run on Lasix. But probably the most frightening thing, like we just talked about, the respiratory health in a horse trailer. So we have a horse that bleeds, and then we stick them on a trailer and haul them for 10 hours. And that is the perfect nidus for a respiratory infection. So where I don't think every horse that bleeds needs to go on antibiotics. If we're having to put them back in a trailer and haul them quite a ways, we may need to put them on what we call some preventative or prophylactic antibiotics to try and avoid a respiratory infection when we travel with them.
Well, that's really helpful information, as we know that there's so many things that we can do and there's other things that we can't. So it's nice to be able to get those helpful hints. When you're worming a horse and trying to take care of them that way, I've heard that there's some immunities that are built up to different types of wormer. And what's the best program, in your opinion, on keeping a horse worm-free?
Yeah, so that's a good point because over the last 20 years, we haven't come out with too much new warmers. Quest is moxidectin is a cousin to ivermectin, and that's all we've had that's new in quite a long time. So there have been some resistance built up. So for those of you that are lucky enough to have pasture, not like us here in the desert, and parasites do exist, the best probably is to run some fecals on your horses because we're avoiding over deworming. If we run a fecal and they don't have any parasites, we take a little tiny piece of a manure, you take it in, have an egg count done on it, and they don't have any, then you don't necessarily need to deworm that horse at that time. So usually in the fall, we'll always use, in other parts of the country, a boticide, so your ivermectins, moxidectin, we'll get those. And then we would rotate through the dewormers as we go. But really, I think for a long time, horses were over dewormed, and that led to the resistance.
It's the same way with like antibiotic over antibiotic use, then they become immune to that. When a horse becomes has that snotty nose and that, is there a way that, should you always have that diagnosed before you put your horse on an antibiotic and make sure that a veterinarian has seen your horse if they get that?
Ideally, right? Ideally, especially if they've been around a lot of other horses, especially if they have a fever. I think if they have a fever, 100% always.
Always go to the vet.
And sometimes you might end up somewhere where, they've got a little bit of a snotty nose and you have to haul home. Again, it would probably be a good idea to have them looked at so that doesn't turn into a shipping fever or a more trying problem down the road.
Well, and I think another overuse that we've talked about is butanbanamine. A lot of times people run it and then it gets set up a immunity to it. I mean, it doesn't work as well. And on those inflammatory drugs, is it okay to standardly practice of giving your horse, those type of drugs to help ease their discomforts?
Yeah, so those products are non-steroidal anti-inflammatory disease or problem drugs, sorry, NSAIDs we call them, and they're like our Motrins, our Tylenols, are things that we would take. And I think people have really gotten to the practice of using them because they have so much invested in a trip, right? It's like rubber bands on your feet. Right? I have driven 1,000 miles, paid $500 in entry fees, and I'll be damned if I'm going to blow a stirrup.
Right.
And the same thing is happening with our anti-inflammatories. Gosh, I don't want my horse to hurt. I don't want there to be any limiting problems because I've come a long ways to make this run and I want to make sure they feel great. And I think that's where it's kind of come into. And a lot of those horses that are hauled a lot, they think, oh, they probably get a little bit achy on the trailer. So occasional use of an anti-inflammatory is not a bad thing. And some of those horses we would recommend go on a little gastroprotectant, so your ulcer guards, sucralfate, things to help take care of the stomach, because they can be ulcerogenic. Now, more recent times, people will use Equiox, which is caprofen, or it is actually a non-steroidal that isn't quite as irritating to the gut. And so it's like the Tylenol of the horse world and a little bit more friendly. So.
Yeah. Do you think that horses have improved in longevity? Or do you think we've overused and what is kind of an average lifespan, do you think, of a horse?
Yeah, so that's a really good question as far as barrel horse longevity, right? And I think as the futurities get bigger and bigger and bigger, we're running those horses hard, young, and that's where we're really pushing them because that's where the dollars are at. And so I do wonder how long they're lasting. It seems, of course, when we're kids, we didn't know as much, that they all were running into their 20s, right? And doing fine. But you go to the NFR now and they're 5, 6, 7 years old. We don't have as many older horses.
Peak younger. And that's probably because we've overridden a lot of them and they've got some soundness issues, or they just, you're compromising their longevity by overusing them. But,
mentally and physically.
Yes, mentally and physically. And that's a good point. When you have a horse that is really mentally not at their game and they're resisting coming in and everything, do you think it's mostly a soundness issue at that point? When people come into you, I mean, it's a big question, but
yeah, and it is. It's the needle in the haystack again, right?
It's still.
So they're not going in because they don't like something that's happening in there.
Yeah.
It can be pain, and it can be rider. It can be a lot of different things. So I always recommend that we look at those horses, you know, and we might scope them. We might do what's called a bronchoalveolar lavage. Are they bleeding? Is their musculoskeletal system a problem? Or do they have ulcers? You know, so you have to kind of go through all those steps and check those things off the list to see if it's happened. They are telling us,
Yeah,
but they can't tell us exactly
in
why.
our own language.
Yes, why that they won't go in.
Yeah.
But we get so many of those horses that are great, 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 and all of a sudden I don't want to go in the arena. Well, so you have to back off a little bit and look at it. And you know, I like to get the clients talking, because once they're talking, it takes a while. But sometimes it might be 30 minutes into it, and it's like, well, okay, you should have told me that. Like, I got it now. This is what it is. So there's a lot of didactics of kind of going through it and trying to figure out why they're having the problem. Is it just strictly an anxiety, that they're nervous and scared? And that's more common in the young horses, right, as we put more pressure on them. But the older horses, the campaigners that have been doing their job and doing it well, and all of a sudden they're like, then you got to really look. Something's wrong. Is something bothering them through the musculoskeletal system? Everybody's heard the buzz lately. We've really come a long ways with diagnosing our back problems in horses. Is that genetic? Is that saddle fit? Is that rider? Those things we don't know. But I have had horses walk into me for lameness exams, wanting their hocks injected, their stifles injected, everything along the way. And I'll watch these areas on them with white hairs over their withers, rubbed hair on their back or their lumbar area, and literally having sores, and ask them to bring their saddle and have a very poor fitting saddle. I said, absolutely, I'm certainly happy to help you with these musculoskeletal problems, but let's talk about maybe getting them a saddle that fits. And it amazes me that people would bring me horses and spend thousands of dollars diagnosing and treating problems, yet they won't invest in a saddle that fits their horse. And I think it's very important to have a saddle that fits, not too wide of a tree that's sitting on their withers, making sure that things aren't rubbing back on their lumbar area. You know, we just need to make sure that they're comfortable. We want their shoulders freed up. We want things to be balanced. We want to make sure that these horses aren't getting sore because what's on their back doesn't fit them.
Yeah, that's like one of the biggest culprit to a sore horse is a poor saddle fit, where the cinch isn't placed right, all of the different things. And we're so happy and thrilled that you have embraced the burn saddles and that you ride them. And what's some of the differences that you've seen in the burn saddles that's helped with your horses in their saddle fit?
Yeah, so I have a really short-backed mare, and so she was a little bit tough to fit in her younger years because she was pretty wide and short-backed. She's changed a little bit as she's aged, and that's the other thing that's super important that people don't think, well, they've had this saddle forever. I'm like, well, right, they're 17 now. They were 8 when they got the saddle. You know, their body has changed, just like you and I can't wear the same jeans we did when we were in high school. The horses might change as they mature, or, you know, or they age, either way. So I think just having a saddle that fits very well, that's well balanced. I like the taper in the back of the tree, so we don't have things digging into the back of the saddle in their lumbar area or caudal thoracic. Making sure that it's not sitting too far down with the gullet sitting on their withers. You know, taking into account all of those things that go along with it. Plus, it's a very comfortable saddle for a rider. I think the way the stirrups are fit and the seat is made, you know, it's super comfortable. And I will tell you, my husband will be the first to tell you that years ago when my mare went from a 2D mare to a 1D mare, he absolutely credited the saddle. Oh. And he said to me time and time again, so what'd you do different? I'm like, I don't think I did anything different. I was like, no, I don't either. It's like, you got a new saddle.
To your point, I mean, you wouldn't leave poor fitting shoes on a horse. You know, it's the same way with the saddle. And that's what we like to offer, are those free saddle fittings, so that we can really see, because I think that a lot of us just go out and ride and we really don't understand it, of where it should set or how it should be. So that it is very important not only to get the proper fit, but to put it on the proper way and make sure that your pad is right for your horse. And there's a lot of moving parts to this, and all of them play to safety and well-being for you and your horse.
Yeah, absolutely.
Yeah.
And there are things that, there are horses that can perform with underlying lamenesses and problems. And when they do that, and it's not a bad thing, as long as you have a diagnosis and you know how to make them comfortable and that they can go and proceed, we can sometimes deal with the horse's little limitations. But just like you might have, a sore foot, and then you get sore up through your back and all the way through your shoulders. The same thing happens with horses. So I see some horses that get sore feet, and inherently they get sore up above their scapula. So now you have the saddle sitting and pushing up on it, and you can imagine like somebody tightening up in your back with a dial, and then getting tighter and tighter. And I've had them where they don't look so lame, and I put a saddle on them and they can barely walk. One that doesn't fit very well. And I do think that, you guys have been so great with your saddle fittings and showing how it should properly be put on and slide. Because as a kid, right, you throw it up there, you pull on your breast collar to make sure it's way up, and then you wonder why it slides back. Well, because that's where it's supposed to sit, right?
Exactly.
Not up over the top of their withers.
Yeah.
So I think that's important, taking the time to think about that and going back to, you get what you pay for. And you can pay for the saddle or you can pay the vet. And I'm happy, but I'd rather the horse feel good.
Do you like to be a mom on the sidelines, or do you like to be in the saddle competing?
Oh gosh, I like it both. I like both parts. I get more nervous for my kids to run than I do running. We've had a couple of very, very busy years at my practice at Desert Pines here in Las Vegas, and it's been kind of crazy. So I've kind of pushed everything off to the girls for a while, and I really do enjoy it. There's nothing better. And when we're all running, it's even better. I love to get beat by them. If anybody's going to outrun me, I want it to be them. So it's fun. It's been so great to see their skills develop and get tougher in the pen, and take horses I didn't think they could do anything with and do something. It's been pretty special.
How competitive are they? The three of them. Are they their own best friends, or do they have a lot of, I was gonna say 3 daughters. I can't even. Yeah.
No, you know what though? They
fighting over bits and all of that,
there's a lot of fighting over bits, and that's mine, and don't use that pad and that. They don't fight over horses, so to speak. They kind of all have a little bit different styles. Years ago when Lindy started running Jersey for me, and people would ask me all the time, gosh, is Markel jealous? Like, is she jealous that you don't let her ride Jersey? I'm like, she doesn't really like Jersey, so no.
Yeah, horses fit people, right?
Yes.
I mean, they do.
Yeah, and so it was interesting because I think, Markel started a few, and so Lindy really admired that Markel was able to start the colts and go, and she kind of wanted to do that. And there was a point where, I don't want to ride your horse anymore. I want to do it myself, right? So it was a challenge to her. So I think they admire parts of each other. This past week, we decided that we were going to forego the American semifinals and stay home. Jersey's just coming back off an injury, and she wasn't fit enough. So we stayed home, and at the 11th hour, I got a phone call offering Lindy a jump ride, and she's like, okay. And I said to her sister, I said, would you do that? Like, would you run down there and just jump on one? She's like, no, I don't do that. Lindy does that. I don't do that.
Lindy is a free spirit.
Yes, they admire each, they all admire the things that the other is able to do. And they've been very supportive, helping Reese too, when she was real little and she's got the biggest horse, can't get the saddle on, so always been very helpful for Reese, and she's moving up, going to give them a run for their money now, I think.
Growing up, every time I see them run, they're just more mature and just more polished, and you have a beautiful, wonderful family.
Thank you.
How did you meet your husband?
Oh, so he's a client. Well, he worked for our very best client. So he worked for Paula and Michael Gahn from here in Las Vegas, and he ran their ranch, and I met him out there, and so I would always try and take the calls from my other associates so I could go out and treat whatever was there. And it actually we kind of got together over one horse who had a terrible injury, and it was kind of an awful situation, but we spent a lot of time together over that horse. And then he finally asked me to dinner, and I wasn't sure if I was just like the friend dinner watching the horse, we were going to dinner, or we were really going to dinner. And so I dressed somewhere in between and got in the truck, and we drove up to Ruth's Chris, and I thought, okay, so we're going to dinner.
It's like a real dinner.
Yeah, it's a real dinner. So the rest is history. It's been pretty fun all along the way, and he's so supportive of the girls and has brought them so far. And
such a great rodeo dad. Daryl's just a bright light, and helps anyone that needs help in the arena and outside of the arena. And you have a wonderful family.
Thank you.
You're so you're so driven, and you have such a wonderful practice that you've built up. And everyone that knows Dr. Lamb, he's just a magic guy. You know, he was always the one that if you could get to Vegas, your horse, you felt like had a chance.
Yes.
And he came up with so many potions and different things that was very directed just to him and how he did. So who has been some other mentors in your life?
Oh gosh, that's a good question. You know, he's probably number one, and he retired this past year, so we still talk quite a bit over cases and things. And oh my gosh, that's a good question. I feel like a rodeo queen again asking me for mentors.
If you could give, a Save World Peace or World Peace or whatever.
You know, I've got quite a few colleagues that I've looked up to over the years that are always just a phone call away, which has been, fantastic. I know you talked to Kathy Grimes earlier, who is a dear friend of mine, has been very supportive over the last few years. I don't think I could have, I was able to hit some circuit rodeos and get down the road a little bit, and I sure would have never been able to do that without her, because she pointed me in the right direction on how I was supposed to do everything, and pushed us a little bit.
Did you know her in the Northwest when you lived up there?
Yeah, so it's a really funny story. Yes, I don't think she knew me. I knew her. She had a really nice horse named Poco when we were kids, and she lived quite a ways away from us, but at state finals and our big events, we'd see each other. And in 1999, when she was first starting her breeding program, I did a pre-purchase exam for her, a horse that was going to be a broodmare from here in Las Vegas, and it was a Judge Cash mare. And my staff said, oh, this gal's a veterinarian. You should call her after the exam. I said, okay. So I looked at the name. I'm like, Kathy Grimes. Wow. Okay. It's been a long time. So I called her. I said, hey, are you Kathy Grimes that used to run barrels? And she's like, well, I run barrels. I said, oh, okay. And did you have a little buckskin horse named Poco and a sister named Brenda? And she's like, yeah. And so we kind of talked then, and that was that. And then years later, when I was ready to kind of get back into the barrel racing world, my husband kept picking out horses, and I found one. I'm like, I don't know, I don't really like that. And when I would Google the horse, there was a congratulations from her, because this gal had bought a horse from her. And I'm like, oh, Kathy, I should call her. Maybe she has something. So I called her up, and I asked her about an older gelding. She's like, you don't really want him. He's not a 1D horse anymore. She's like, but I tell you what, I've got these twin mares. They were her first embryos, one being Jersey and one being Izzy, that she took to the NFR. And she said, I wasn't going to sell them, but I'll sell you one. I said, okay. And so we talked a little bit, and she called me the day I was supposed to go up and ride. She's like, Izzy's got an abscess, so you won't be able to try her. I said, that's okay. I like Jersey better anyway. So, and people often ask me, gosh, did you pick the wrong one? And I said, you know what?
There was no losers.
I said, we picked the right one for us, and she got the best one for her. So since that time, we've been very dear friends, and we have, I think we might have as many KG horses as she has. So
yeah. I know, I noticed that. It's like, yeah, and I wondered what the connection was. What a special relationship. It's so amazing how this circle comes together, and how we meet some amazing people that was in our past life that we didn't even know when we were being raised up, and then we come and join together in another setting. So what a wonderful thing. What's next for you?
Oh, what's next for me? What month is it? February. Yeah. Got phone calls today, already working on the NFR for this year. That's crazy how
Yeah,
fast it all goes,
well,
you know?
and see, and you're
Tied
a
up.
very active person at the
Yeah.
NFR. Talk about that just a little bit.
Yeah, so I was lucky enough to ride in on Dr. Lamb's coattails in 1996 when I joined him. And so since then, I've been there every year. This will be the 26th year.
Amazing.
And
You look like 29.
oh, you're so sweet. 26 years. So it's been fun. We have what makes that so special is I mean, obviously I see it from the contestant side because so many friends and people I've had inside the arena, but really what is always amazing to me is everything that happens behind the scenes, which wouldn't be a surprise to you because you know what you have to put into an event to make it happen. And, you know, the livestock crew that really has the animals' best care at mind, and the changes that we've made to address, you know, animal welfare and make sure that we're staying up with current times and doing everything we can nutritionally for the animals, medically for the animals, making sure everything that happens inside that arena is great. So that's been fun as we go along. This spring will go right into breeding season, so that's a busy time for us. With that comes babies and breeding mares, and then more colics and everything as we go through. The girls' high school rodeo season just started back up, so we'll be busy with that for the next couple months. Reese has already got her eyes set on Georgia for the junior high finals, which unfortunately conflicts
Why did they
with
move that far?
and it conflicts with your finals, which
Oh,
is sad.
Dang, yeah.
So I got 2 of them qualified, and she's like, I'm going to Georgia, Mom. I'm like, okay.
That's a long haul.
So
It's good they've got a good vet.
yeah, hopefully that'll pull us into summer, and then maybe hit some circuit rodeos again this year. And
Georgia in June?
yeah, we're really looking forward to it.
What?
But they say the facility is very nice, so I said we just got to get there early because there will probably be fluids involved, lots of electrolytes and things because it'll be hot.
Yes.
But yeah, so high school rodeo trail, busy breeding season, maybe starting to hit some circuit rodeos again this summer. Kind of took a few years off, so hopefully get back at it.
We wish you nothing but the best in all of your endeavors. You are the busiest person. I just am so grateful that you took time out to visit with us. And I know that your information is going to be very helpful to our viewers. And yes, check out, if you're ever in Las Vegas and you need some help, your practice, are you open for them to be able to?
You bet. Desert Pines Equine Center, like I said, we have now quite a few specialists within our practice, which is great, and become a little bit more of a referral center. Hopefully by the end of next year, we'll be adding a little smaller new facility with some new diagnostics, bone scan, scintigraphy. So things are growing, but we do have 2 surgeons, 2 great surgeons, internal medicine specialists, and several of us working in the practice. So it's a fun place.
If you need some help, that's the place to go, Desert Pines. We really appreciate Dr. Leslie Schur. She's been a friend and just a wonderful contributor to the barrel racing industry. So watch us on our podcasts every other Thursday on all the major podcasts, as well as our YouTube channel. Thanks, and we'll see you down the road. Happy trails.